Hello, I am Dr. Rohit Deshmukh, consultant psychiatrist practicing in Mumbai. So today we will be discussing about mental health and the disorders that we have in mental health. So do you feel low? Do you procrastinate a lot? Or do you have difficulty focusing on things? So you might have ADHD, depression or anxiety, because in all these disorders there are few common things which overlaps each other. So to identify these illnesses, we need to know these illnesses in detail. So to begin with, we can start with ADHD. What is ADHD? ADHD is a neurodevelopmental disorder. Obviously, neurodevelopmental disorder means it begins in childhood and carries forward in your adulthood. But many of us, even in adulthood, even after having this ADHD, we don't even know that we have ADHD. So how can we identify this? How can we know that we have ADHD or we are going through something else? So to know that, we should know the signs and symptoms of ADHD. So the few common signs in ADHD are difficulty focusing, difficulty sustaining attention, then you lose out on things very easily, you lose your focus, you tend to zone out, then you forget many things. These are common signs of adult ADHD. Even in children, the ADHD symptoms are quite similar. They can't sit at one place, they are hyperactive, they are very impulsive, then they forget many things, they lose things in school. So these symptoms are very common in ADHD. So first of all, why does this happen? What is the neurobiology behind it? So in ADHD, to understand the symptoms, we need to know which chemicals or which hormones are involved in this ADHD system. So our brain has two main neurochemicals. One is norepinephrine, other is dopamine. Norepinephrine has a role of catching the signal, while dopamine have the role of stopping the disturbances. If the balance gets disturbed, then you tend to forget things, then you tend to lose focus, because your brain will either not catch the signal or it will be unable to stop the disturbances. So when these things are happening for a longer time, your personality tends to be like that, or they will start blaming you according to the symptoms that you show up. So how to treat it or how to identify it? So for identifying or diagnosis, you need to visit a psychiatrist. Psychiatrist will evaluate you in detail and they will formulate a management plan, which will include ADHD testing, which will be done by a psychologist. Once ADHD testing shows that you have a ADHD, you can move ahead with the management plan. So ADHD management includes medication as well as therapy. So which kind of medications? So there are stimulant drugs, which includes methylphenidate. This methylphenidate, the stimulant drug, balances your level of norepinephrine and dopamine, which will bring your focus back, which will help you focus more on what you want, which will help you organize things, plan things and be better in future life. Then the second class of medication is non-stimulant, which is atomoxetine. The person who cannot tolerate the stimulant, because stimulant drugs have few side effects, like they can make you irritable, they can have gastric disturbances and they can disturb your sleep. If any of these side effects are found, then we shift to non-stimulant drugs like atomoxetine. The atomoxetine also works in a similar manner by balancing the norepinephrine and dopamine levels of your brain. Then comes the therapy. Therapy includes planning your day, breaking the task into small things, small tasks, so that you can follow it. Then scheduling your whole day according to your lifestyle. It cannot be normal because you have ADHD. You have to plan it in a different manner. So once you start planning this, your life will be quite better. Also, you have to reduce your smoking, reduce your caffeine intake, because this kind of thing stimulates you more and make you more anxious, so you won't be able to follow your routine. So you have to go through all this process, and it is a long process. It's not a short-term process that you can expect changes in few days. You have to be in that process and slowly you will get better. So in ADHD therapy, we can break down into child therapy and adult therapy. In child, the therapy is quite different, because in child we have to manage their studies, their routine. So for that, you can set up the routine for a child. When should the child get up? When should he do his routine daily activities? When should he study? And when should he play? If you plan this and if you make child do this, then it will be helpful for that child to maintain a routine and get it through his ADHD. Along with that, in child, medications are very important because they themselves cannot analyze the situation. They find it very difficult to manage the situation on their own. So medications add on to the therapy will always have a good effect. While in adults, many of them won't require medications. In adult, they have to plan their day, they have to break their task in short different tasks. Then they can even plan the day according to their personality. Adult ADHD, one of the most important thing is to identify the weak points that they have so that they can plan accordingly and they can work on their weaknesses. Like if they can focus on things, then they can choose a profession which doesn't require a sustained attention. They can go to some other job where the sustained attention is not required but creativity is required, because in ADHD creativity is quite better. The only thing is focus. So if the focus is being managed, then the person won't feel any difficulty. In this manner, this ADHD can be managed. Now another question is, if the medications are started, how long does it continue? So in children, generally medications are continued till their academics are going on, because in academic part we cannot manipulate things. The system is fixed and we cannot adjust according to our child. So we need medications to help them adjust to that system. While in adult, we can easily titrate the dose, we can make and adjust the dose according to the person, and it differs for different individuals. So in this manner, ADHD can be well managed and the person can overcome it very easily. And the last but most important part, ADHD is not a disorder per se, it's a part of brain biology that has been developed in a certain manner that makes that person have those symptoms, and the person can manage it very easily. So we should not get into the stigma of having ADHD. Instead, we can identify those signs, we can work on it, and we can get better. Thank you.